300 to 400 physicians in the United States die each year by suicide.
Oh my gosh.
So that is about one doctor every single day of the year. And there are some folks who think that 300 to 400 physicians per year might be low because doctors have connections, and if we have an unexpected death, sometimes people will report it as a different cause of death than actual suicide. But yeah, about one doctor a day.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel. Welcome, everyone, to the Pinnacle Prescription Podcast. I'm your host, Dr. Rupa Wong, and today I'm joined by Dr. Bianca Bynum for Physician Suicide and Burnout, the Dark Side of Medicine. Dr. Bynum is a board-certified psychiatrist practicing in Atlanta, Georgia, and she recently graduated from Child and Adolescent Psychiatry Fellowship. She has a passion for empowering and educating youth and their families to take charge of their mental health. Dr. Bynum, thank you so much for joining us today.
Yes, thank you so much for having me. I'm so excited to be here.
So let's just dive into this, because this is a really neglected topic in medical school, in training and residency, especially when we're caring for ourselves. And you've been really open about your own battles with depression and anxiety during your training. So would you mind sharing a little bit more about how you navigated these tough times and what drove you to focus on mental health for medical trainees?
Yes, absolutely. So I started medical school when I was 21 years old. Looking back, I felt like such an adult, but looking back, I was so young. And I remember, going straight through from undergrad to medical school. You have to have a stellar GPA, MCAT, all of the things. And I was used to being the best or, at the top of the class in college and high school. And I had never been in an experience where I wasn't, outstanding. And so I remember when I got to medical school and we took our first test, I got really nervous and I didn't do well. And that really kind of was the match that lit the flame that kind of started kind of my journey with dealing with depression and anxiety. I think that, kind of navigating to adulthood, being fresh from college and the stress of medical school. Everyone says it's like drinking from a fire hydrant, and it felt like I was drinking from the ocean, honestly. So, it really bothered me that, I wasn't, the top, I wasn't the best. I'm very competitive with myself. And as medical school, that first semester was really challenging. There was a lot of changes in my personal life and adjusting to school. And I felt so alone during those days. I have a group of great friends from medical school. We have group chats, we do Zoom, we do vacations together. And so when I started kind of coming forward to some of my friends and saying, hey, something's not right. I'm feeling, not like myself. There was an abundance of, Bianca, me too. I'm not feeling okay either. And so when I first kind of started speaking with friends about it, like with my classmates, I felt way less alone. And as I've navigated through medical school and residency and fellowship, there's been ups and downs, but prioritizing my mental health, going to therapy, acupuncture was transformative during my USMLE study times. So just, being able to have conversations with folks that were in a similar situation was helpful. And my family, my parents and my siblings have been my rock. And I met my husband in residency. And just being able to have candid conversations and also kind of tell people about my warning signs. That's what I've kind of evolved to do, is telling, family members, hey, if I am not as outgoing as usual, if I'm not, excited to go to XYZ place, that might be, a warning sign that things might be getting hard for me.
I love that you recognize that about yourself, and you were doing so really early in your training. I mean, in your medical school education, so you didn't even know psychiatry yet. You hadn't even decided to pursue it, right?
And I wanted to be an REI, so like reproductive endocrinology and fertility. I'd always thought I was going to be an OBGYN, but my own kind of journey with mental health, I remember, I was eating a cupcake with my good friend who's a primary care physician now. And she was like, Bianca, I really think you would be amazing at like child and adolescent psychiatry, which, is a very small field. And I was like, no, I don't think I would do that. I want to do REI. But my friend was absolutely right. And I fell in love with psychiatry from the first like 30 minutes of my third year rotation. I was like, this is it. OBGYN, that was a cool, like, interesting passion that I had for so many years. But psychiatry just won me over because I felt like, as a psychiatrist, especially working with young people, I could kind of have a specific understanding of what they're going through. And if not the same exact situation, just empathy and being able to empower folks to heal themselves and go on their own healing journey. I think it's so easy to look at psychiatrists or therapists or any mental health professional as someone who can like fix you or give you advice. And I always say I don't really give advice. I empower people to take their own wise advice. And through a combination of medication and therapy, getting back to a vibrant life full of hope and joy. That's kind of where my passion lies.
I love it. And I also love the fact that you really encapsulated, I think, what psychiatry is about. So as I was mentioning to you before we started filming, my mother's a child and adolescent psychiatrist. So I actually went into medical school thinking that's what I was going to do.
Wow.
And she said, go ahead, but you're not going to do this. She wanted me to come to the realization myself, of course, as any psychiatrist. Yeah. She said, that's likely not going to be the field for you. And she was right, because unlike you empower people to find their own path, right? That's what psychiatry. I like to fix things and I want it to be done. Yeah. And that was something about my personality that just didn't fit with psychiatry. So what you said is so good. But I want to go back to something you mentioned when you were talking about your own experience. You were talking about the warning signs, and not just the warning signs that you were checking in with yourself about, but then you also told your support network, your friends and family, to be aware of those. What are other warning signs that maybe you could help for trainees or students who might not be as self-reflective, or, especially now that you have the professional expertise in this particular field? What are other warning signs that they should look out for so that they understand they need to check in with themselves about their mental health?
Yeah, that's great. I think of the whole like SIGI caps that we learned in medical school.
It's a long time ago for me.
Yeah, so
review it.
Yeah, I'll review that, of course. But SIGI caps is kind of the acronym, and I think the first S is for like sadness, I is your interest level, G is guilt, E is energy level, C is concentration, anhedonia, which is like loss of interest, and then psychomotor changes, which can be like feeling slowed down. But to kind of break that down into more simple terms, some warning signs are changes in sleep pattern. In medical school, residency, fellowship, a lot of us stay up all night, not because we want to, but because we're on 24-hour call. But I kind of talk to folks and I'm like, when you can sleep and there's no barrier to sleep, if you're not working, you're doing a 24-hour night float, is your sleep disrupted? Are you oversleeping? Sleeping like, more than 10 hours a night? Do you have a hard time waking up in the morning out of proportion to the, hitting snooze a few times? Another big thing for me is anhedonia, or loss of interest in things that you usually like to do. I have some friends who, are really into art or really into video games. If they're not doing those things that kind of naturally bring them joy, and they were before, that's a warning sign. also your appetite can really change, decrease interest in food, but also I know for me personally, food became a coping mechanism for me when I was feeling really stressed out, just wanting to eat like all the Jenny's ice cream, and just checking in with yourself, and also looking at how are you connected with others. Are you still talking to your friends? If you call your family on the weekends, have you spoken to them regularly? Are you doing the things that traditionally you enjoy doing? And I think that when we are in medical school or in medical training, we can easily excuse it and say, well, I'm not doing the things I enjoy because I have no time. And that is absolutely valid. But I always kind of like to say I try to find joy amongst the circumstances. So when you notice that you're unable to find joy, even from seeing patients or a really interesting case, like when you feel that your energy level is off, or that it's hard to find joy even in happy circumstances, that's a time to check in with yourself. And also, I encourage folks to ask for feedback from loved ones and say, hey, to your sister or your brother or a loved one, how do you think I'm doing? Is there anything that you've noticed? Are there any concerns you have? Sometimes it can just start with a feeling of feeling off, just in general. And all the symptoms can be different for everyone. But I think that something that I have kind of gotten my friends to do is there's this website, I think it's called MD Calc, where you can do a free depression screening called the PHQ-9, and you literally just Google PHQ-9, and it's a series of questions. And a lot of my friends who weren't depressed actually did that survey, the PHQ-9, online, and it doesn't replace medical care, but it can at least kind of give you open your eyes, like, oh, I thought I was just having a crappy day, and you answer the questions for how you've been feeling the past 2 weeks, and it gives you a score. So that can be really helpful too, to get data, because physicians were very scientifically minded.
Yes, and I think we do kind of what you alluded to as well. I mean, it's hard whether you're a physician or another healthcare profession. Our training is difficult, and it's a lot of lack of sleep, overworked hours. So it seems like we need to just push through. At least, when I graduated from med school 25 years ago, that's what was the prevailing thought. You push through. And so sometimes then it feels hard to think, wait, this is not normal, right? This isn't just the circumstance. And you need to do something else. You need to actually investigate. So I think that online resource that you mentioned is great. And even just checking in with your support network, as you talked about. Now, you've in general also talked a lot about the complexities of getting good mental health care while in training. What practical advice can you give someone who's struggling but feels, overwhelmed by the healthcare system? They're worried maybe about the stigma still, right, associated with seeking help. What kind of advice can you give them?
Yeah, so that's a really challenging thing to do, navigating the mental health system. It's not intuitive. Even, sometimes for me as a psychiatrist, if I'm trying to get a family member or loved one help, I'm like, how do we start? How do we go about this? But from what I've noticed, the best resource is to go to your insurance company's website. And there should be a behavioral health care portion of the website. And most insurance companies have a list. If you type in your zip code or your location, and they'll give you a list of psychiatrists or psychiatric nurse practitioners who are in network, who are covered, and usually can tell you if they're accepting patients. Sometimes it's a little hard just doing a random Google search, because you kind of go into an abyss of resources. So I would say checking on your insurance website, asking your primary care physician. Another great resource is that most medical schools or universities or residency training institutions have referrals, and I believe through ACGME or what is it, like the medical school portion of the ACGME, they have wellness resources. I believe that each medical school has like a requirement to have referrals. And there's also growing numbers of therapists on medical school campuses and therapists that are residencies and fellowships can make referrals to. So checking with GME or your medical school wellness wellness office could be a helpful resource. But there also is that kind of fine line where you're walking, where you don't necessarily want your medical school to know that you're struggling, or you don't want your training institution to know that you're struggling. And I think another great resource is psychologytoday.com, where you can literally like kind of stratify for what you're looking for. If your gender is a preference, if area of expertise is a preference, if you'd rather do virtual or in person. So I guess my top two would be your insurance company's website for their behavioral health webpage, and then also psychologytoday.com.
Oh, those are great resources. I actually would never have thought to go first to the insurance company's
Yeah,
website.
that's what's been helpful for me the most, because one, a lot of mental health clinicians do not accept insurance.
Right.
And two, if you go directly to your insurance company, you know that they have been vetted as well. So, the insurance would have checked their credentials. So, that you get a higher chance of seeing a high quality clinician. And something that I encourage folks to look out for is to make sure that your psychiatrist is board certified. If you're seeing a psychiatric nurse practitioner, that they actually have like the psychiatric nurse practitioner designation, because psychiatric nurse practitioners go through a different sort of training than, for example, like a family nurse practitioner who focuses more on primary care. Psychiatric nurse practitioner school is a lot different and is more focused on mental health and the medications that we use in that kind of arena. For therapists, make sure that the therapist or psychologist is licensed, and all of that. Like going to the insurance company's website, it's kind of like gatekeeps a lot of the resources, and kind of making sure there's that everyone's been vetted, so that you can go in with somewhat of an assurance that you're going to see someone who can be helpful for you.
That's great. That's such great, just practical advice in case someone needs it. I love that. And we kind of touched on this. You mentioned it. Just the hurdles and the stigma that often stops medical trainees from searching for help, especially women, right?
Yes.
How can we start breaking these down within the medical community?
Yeah, I think that, I have a whole dream that one day medical students and, medical professionals, our mental health will be taken just as seriously as if we broke our arm or had major surgery or something like that. So I think that as the generations, with millennials and now Gen Z coming into medical school and residency, I think just being more open with yourself, with your loved ones, I think that's how we kind of start taking charge and kind of bringing into the arena of medicine a notion that it's okay to struggle, that it's okay to not be okay. And I know that that's like a big cliche, but the longer that you keep the fact that you're struggling in, it's like a snowball effect. And eventually, it's, instead of it being a tiny snowball, it becomes a big snowball the longer you wait to talk to someone. And whether it's a classmate, a loved one, in your family, or someone from college, just being able to have those conversations is really important. On a systems level, it would be my hope that, because there is kind of this fear, okay, if I come out saying that I'm struggling with depression or my mental health, will that affect my licensure in the future?
Right.
Will that, that's a big, that's still something that I think this nation has room to grow on. Because I do have some folks that I know who've come forward and had some monitoring on them that they felt wasn't helpful when they were just looking for help. So it's a very kind of touchy area, and I'm hoping that as time progresses, physicians' mental health will not be stigmatized. And if someone has to have their appendix removed in medical school or residency, that appendix removal doesn't follow them when they're applying for their state licensure or credentialing for a job. But sometimes mental health disclosures may.
Exactly. And that's the difficulty, right? And
Yeah.
we don't want that to be the hurdle or the choice that people are
Right.
facing when they decide to seek help, which is really troubling. And so that kind of segues into something I wanted to ask you, because you've been super open about your own struggles. But can you just share with us your personal journey towards healing? How have your experiences shaped your approach and practice with your patients, your advocacy work, even just your interactions with your old classmates?
Yeah, so it's kind of like when I go into a new patient room, or now with the telehealth world, meeting a patient and their families virtually, I kind of go in with the approach of, this is an honor of a lifetime to be able to be involved in someone's life, especially a young person, in this way. And I kind of reflect back to being younger, in my early 20s, and how hard it was for me. But things that have helped along the way is definitely having those connections. I would make time with my classmates, who I call my sister friends, for we would have, I think our tests were on Thursday mornings in medical school. So Thursday afternoons we would go get our nails done, or go out for a random brunch. So just trying to find joy in the harder days, and being intentional, being like, okay, I know that we have to study, but we are human, so let's schedule out something fun and relaxing. I remember we went whitewater rafting at the beginning of our second year of medical school. It was a group of 15 of us. We drove 3 hours, but we were serious. We were like, we're going to have fun. We're going to start, I think we were starting heme lymph, organ system. We're before we learn about all these cells, we're going to go whitewater rafting. So including fun, scheduling joyous activities. Something that's also been really helpful for me on my journey is breath work, and especially yoga, the practice of yoga. I think having a physical activity that also integrates mindfulness into it has been really helpful, because not only am I getting my blood pumping and getting active, I'm also having time to reflect and do my breath work. Prioritizing sleep is something that has been really transformative. I know there's this pressure to stay up late studying in medical school, but I remember maybe midway through my first year, I made a hard boundary that I would not study past 10 p.m. And if that meant I had to wake up early in the morning to study, or I wouldn't get, the next 5 slides, memorized, that's okay. I'd rather be well rested than to be frantically trying to memorize the last 5 slides or what have you. So being firm in your boundaries for your own wellness. And I think that varies from individual to individual. I know for me, my hard boundary is, if there's no emergency, I am going to sleep at 10 o'clock. I need my rest. That is so important for me. And some folks, that I'm friends with, they say, my boundary is I'm going to eat a balanced diet. I don't care if that means that I have to take extra time meal prepping and instead of, doing a block of year-old questions. So just having boundaries with your professional life as it applies to your wellness. And that's really easier said than done. It's taken me a while to kind of lay down those hard boundaries, but it's really important. And it's kind of like the more you do it, the easier it becomes, and the more empowered you feel, because as much as we want to save the world and save our patients, it's kind of like being on the airplane when, if there's any issue in the cabin, you put your oxygen mask on yourself before you go and help others. So just being able to find joy in unexpected places, schedule my own fun, and to have boundaries surrounding my wellness. And, when me and my friends catch up, we always ask each other, what are you doing to prioritize your joy?
Yeah. I love that. Those are 3 great tips. I think the hardest is the boundaries, especially when you're earlier on in your training. You feel like you need to say yes to every opportunity that comes your way, or are you going to miss out on up-leveling your career or your professional journey in whatever manner that you really want to. And I think having those hard boundaries, especially surrounding sleep, emotional and mental health, what you put into your body, is so important. Easier said than done. Like you mentioned, I still struggle. I mean, I think many of us still struggle with it, but we can reset. And I think that's so important for everyone to hear right now, because otherwise it leads to, things that we've heard on social media. I mean, the rash of physician suicides. I know that touched you personally and impacted you. I mean, can you talk to us just about the risks and, particularly for women, or what we can all do as individuals and as a community to help prevent these kind of tragedies?
Yeah, so I was doing a little background research, and according to Medscape, 300 to 400 physicians in the United States die each year by suicide.
Oh my gosh.
So that is about one doctor every single day of the year. And there are some folks who think that 300 to 400 physicians per year might be low, because doctors have connections, and if we, have an unexpected death, sometimes people will report it as a different, cause of death than actual suicide. But yeah, about one doctor a day, if we're looking at the data. That's,
oh my goodness.
I think my medical school class was about 110 folks. So that's like three classes of medical students a year. Right before the pandemic, a classmate of mine from medical school died by suicide. It rocked my world in a way that I will never. I listened to this TED Talk about loss, and the speaker was saying, we never move on, we move forward. So with my loss of my friend right before COVID, I don't think I'll ever move on from that, and I don't want to, but I want to move forward in respecting his memory. And what happened with him has really changed my viewpoint of suicide. I used to think that, okay, if someone's going to die by suicide, we're going to know they're struggling. We're going to know, and we can have some sort of intervention. My friend who died, it was a complete shock. We had just spoken at the hospital coffee shop a few days prior to him dying, and then I get the news, and it's like he seemed to be, doing just fine. So it kind of just reminded me that sometimes the warning signs that we think of don't always appear in everyone. And I think that it just inspires me to take each day one step at a time. And it made me definitely, especially with COVID going on, we were dealing with the new pandemic, just thinking, okay, in honor of my friend, I'm going to take care of myself, and I'm going to do my best job to mentor other people in the field, other medical trainees that are coming after me, to prioritize their wellness so that we're being proactive. I think it's so easy for communities to come together after a tragedy like the one, that my friend had. But I think being proactive and kind of cultivating a culture of wellness, and not just like the free pizza sessions in medical school where they give you pizza or, Chipotle, and like, okay, wellness. Everyone, this is mandatory wellness. But I think that as trainees, like, taking it into your own hands, and what does wellness look like for you and your friends, or you and your core group? Clinically, I've been much more nuanced in my way that I ask the questions about suicide. When I was in training, like my intern year, I'd be so nervous to say, are you thinking about, killing yourself? Have you had any thoughts about suicide? And that's because I had the notion that if I asked someone, it would somehow make them suicidal. But all of the data refutes that claim. So, I'm very, I don't go into the patient room and just ask them that immediately, but I ask more nuanced questions, not just, do you feel depressed? Do you feel sad? I ask open-ended questions, give them time to speak, and listen with the intent on understanding, as opposed to listening to check off a questionnaire or get the questions asked that you're supposed to. And then asking directly, like I've gotten very comfortable with asking not only patients, but folks that I know, hey, I'm hearing that you're really struggling. Has it gotten to the point where you've thought of ending your own life? Have you thought about killing yourself? I think getting comfortable with asking those questions is really hard, but it's so important, because sometimes you when you ask it that way, people will really be open when they're asked that way, because sometimes, people are patients have revealed to me they've wanted to talk about their suicidal ideation, but no one had asked them in that direct of a way. So it's definitely, my experience with losing a friend to suicide has transformed the way I practice. Initially, I was like hyper vigilant about all of my patients, but through therapy of my own, and going to therapy, I've been able to unpack and heal from my loss, and also do my best to help others in a proactive way.
Thank you so much for sharing that really personal story. I'm hopeful that it's going to help someone out there who's listening to this episode to normalize that struggle and to ask for help should they need it. You've shared so many great insights during the episode today. If you could just boil it down, what is your one pinnacle pearl to share with other women in medicine?
Yeah, so my pinnacle pearl would be to look for joy. And what I mean by that is, I remember I was walking into the hospital one day during residency, and I was not having a good day. And I was like, you know what, I'm going to find joy today, because what you search for, you find. It's so easy to look and find the bad in life or in training, but looking for joy and being intentional about looking for joy. I think Mel Robbins says she looks for hearts in her day-to-day life, and she sees the object that looks like a heart. It'll be a reminder to find joy. So whether it's, oh wow, the sky is really beautiful today, or this was a really sweet patient interaction I had, just be intentional about looking for joy. And that's something that has really transformed my life, is intentionally looking for joy, even in the small moments and small circumstances.
I love that. Thank you so much for sharing that. And thank you so much for being here today, Dr. Bynum. Can you tell everybody where they can find you?
Yes, so I recently started posting content about mental health at Hey Dr. Bianca on Instagram and on TikTok. So it's Hey Doctor, like the whole spelling, Hey Doctor Bianca. So Hey Dr. Bianca, and I'm looking forward to sharing more content. I'm really excited about this new chapter as an attending, and that training has come to an end. So definitely looking forward to sharing more on Instagram and TikTok soon.
Wonderful. Thank you so much for being here today. It's been a pleasure.
Thank you so much.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.